There's still a stigma or shame surrounding mental illness. People living with it and those treating patients say it's just not acceptable in society, but they compare it to any other chronic medical problem like diabetes or heart disease. It can be treated.
As Elena Doring.
My name is Helena Doring. Sounds simple enough, but the words that follow took years to utter.
I have paranoid schizophrenia. Everybody went around the room saying what their diagnosis was, and I couldn't say anything. I was so scared.
Scared and ashamed. That's how Doring says she felt 2 years after the panic attacks and her first episode.
I heard voices, and it's very scary too, because you can't control them. And I heard voices, I saw messages in the TV.
Doring was a UAB freshman at the time.
We didn't know what was going on. We had no idea, about mental illness or anything.
She was diagnosed with paranoid schizophrenia. According to NAMI figures, Doring is just one of 2.4 million Americans affected by this serious mental illness.
For a while, a long time, I hid my illness because I was so ashamed of it.
7 years later, she accepted it.
Mi conexión personal.
She now follows a treatment plan and works for NAMI to educate others about mental illness.
It's really helped me because people have been so not judgmental and really open, and it's helped me a whole lot.
That's exactly why the Jefferson Blount St. Clair Mental Health Authority wants to open the door to more discussions about mental illness.
Mental illness is not necessarily a thing to be afraid of. It's a reason to get help.
But fear exists. JBS Mental Health Director Dr. Richard Craig says studies show people who get treatment are less likely to harm themselves or others than people in the general population. But these images stick. Of people with mental illness opening fire inside a Denver suburb movie theater, a Connecticut elementary school, and an Arizona congressional meet and greet.
It is also known that folks who have a mental illness are more prone to acting in a violent way than the general population. Treatment works. Treatment has an impact. No treatment means a detrimental effect, not only for the person, but possibly society as well.
It's not a new idea. Bryce patients addressed stigma in the state mental hospital's newspaper back in 1872. A patient wrote, quote, "As a preventative of insanity, education takes precedence of all other influences."
Earlier intervention, and early recognition, and early treatment will reduce the impact of symptoms over time.
Doring says the medication that is part of her treatment allows her to have a normal life.
It takes really therapy and medicine and a support group, I think, very much. And don't be ashamed of it. Schizophrenia con paranoia.
How early should mental health discussions start? Craig would like to see programs go into elementary schools. Anora Gathings, ABC 3340.